Well, firstly, we know that health literacy is one of the major determinants that will help us address health inequalities. Along with age, along with income, educational status, health literacy makes a significant difference in individuals' ability to navigate their way through a complex healthcare system, to understand the information that we in health provide in terms of health-seeking behaviour, in terms of health-improving behaviour, in terms of informing the choices that people make. Now, if we're fundamentally serious about addressing health inequalities, improving health and well-being, then we need to be serious about improving people's health literacy to enable them to make the sorts of choices that we're all confronted with on a daily basis. Healthcare can do amazing things. It's extremely complex, complicated, and it's particularly complex and complicated for those who are most vulnerable in society. Well, there are a number of priority areas. I think first and foremost, it's for us working in health to ensure that we're providing information to allow people to make informed decisions. That means looking at everything in terms of how we present leaflets about our screening programs, how we provide information about accessing services, how we provide information in an easy to understand way. I mean, one good example I think is the infogram that the four UK Chief Medical Officers have recently produced around exercise. So it's about looking at how we translate messages in a way that people can understand, that they can internalise, and then they can make decisions on. But it's also for us as health professionals, how we interact with people who use services, how we use a language that people can understand, how we can appreciate what it's like to be on the receiving side of health service, and tailor our language, tailor what we do, how we interact appropriately. Well, I think actions such as the event that we're at today, the local and international research that's going on, the fact that we now have a resource, an online resource, where we can all access that information, give thought to how we plan services, how we commission services, how we deliver services. Health literacy needs to be embedded as a strategic approach right across the health service. It's only by ensuring that we improve health literacy that we will address some of the issues that we see in terms of people presenting too late with complications of disease. It's only by improving health literacy that we will reduce some of the demands on our healthcare service.